very good evening to you who is watching UBC TV. Thank you for joining me, Sophia Matovu, on U Health Chat. Now, of course, we still trend with some of the topics that are very big topics when it comes to health. And the topic we are still trending with is ending AIDS by 2030. I'm not the expert when it comes to some of these topics, but I have a very special person with me on set, and she's none other than Dr. Noeline Kaleba, who is the founder of Taso. I know many of you know about Taso in Uganda, but she has a very huge CV. I'll not break it down for you. I'll get her to introduce herself and give you a little bit more about herself. Doctor, very good evening to you.
Good evening, and good evening, viewers. It's such a blessing to have this opportunity to interact with Ugandans through this medium. My name, like you said, is Noreen Kaleva Wanyana. I am of Nsenene clan, and so if I don't really take kindly to people who are chasing after Nsenene right now, I am the founder of Taso, which we founded with my late husband, Christopher Kaleba, who was among the early Ugandans to be diagnosed with AIDS. Christopher was diagnosed in June 1986. He lost his life to AIDS on the 23rd of January 1987. Now, within that space of time, we had been inspired. I can say negatively inspired by the stigma and the isolation with which we were, confronted after his diagnosis. Bless him, he decided before he succumbed to the disease that he would want to do something about it. And we realized that this disease was already with us here in Uganda. This is 1986. At that time, this information was not equitably available to many of us, including those of us, because at the time, I was the principal of the School of Physiotherapy in Mulago Hospital here. And my husband had been working as a radiographer, but had upgraded his education, had gone to Makerere where he first did his first degree, and then he had been working as a teaching assistant in one of the faculties, I forget which one at the time, but had been offered at the time a scholarship from the British Council to go to England to do his master's degree, which he did successfully and completed. And it was the time that he had just finished his master's degree that he was diagnosed with AIDS. He collapsed during a session in school, and he was taken to hospital. And when they did the tests, they found that he was HIV positive. And for me, that was the first time I really getting that information with him so far away from home, because I had stayed home because we had at that time 4 children. I was 32 years old and my husband was 34. We were a very young couple, but we had worked hard, and pretty quickly through the systems, we had had our 4 children. We had already made our decision that we were not going to have any more children, and we were both focusing on seeing how we can prepare ourselves to take care of this. Now, fast forward, before Christopher died, because he died in Mulago Hospital, we started looking through the medical wards, because like I said, I was working in Mulago Hospital, so I had access to patients. So I went around looking for other patients that might have a similar diagnosis with my husband. It wasn't difficult to find them, because the first patients we found with AIDS were totally isolated. And like I've said in many publications, I share this story, and I encourage Ugandans to go to the Taso website and read these stories, because they are published there. But the majority of people with who we mobilized to set up the first support group in Africa for people living with HIV were people who had been left, brought to hospital, Mulago Hospital, and abandoned by their families. For me, That was the first experience of a disease for which someone can bring their loved one to hospital and abandon them. You know that even the poorest family, normally, of course, some circumstances can dictate that some people are left. But at that time, 1986, I had never seen a patient who is by themselves isolated on the hospital. So these are the people that my husband by that time was very weak. He wasn't able to walk, but because I was healthy, and by the way, should say that because he was diagnosed while in England, the British Council here in Kampala made arrangements for me to go to England to be with him, because even by that time he was very, very weak. He had one of the worst opportunistic infections that we know, that at that time absolutely meant death, and that is called cryptococcal meningitis. And for many Ugandans who are listening today, the question would be, was he not put on treatment? There was no treatment for HIV at that time, 1986. And if you were diagnosed and you are already very ill, the time between the time you are diagnosed and when you die was very short. So like I said, Christopher was diagnosed in June 1986. He died in January 1987. But within that period, that's when we did the mobilization. We set up a support group for ourselves primarily, for me, my husband, and those young men and women like David Rule, Jason Bazebulala, Nesta Banyenzachi, Roso Jamuge. These are the founders of Taso. And when I say founders of Taso, I am the only surviving founder of Taso, of the original group. And the reason I will again share with you Ugandans, I did take a test very early when I arrived in England, and I was given a negative result. But the doctor who gave me the results said, "Oh, Mrs. Kaleba, we don't know what is happening because the virus in your blood doesn't show." Today, I know why he said that. He was as ignorant as I was. At that time, the concept of discordancy hadn't been understood. So he didn't know, he had not met a couple where one is HIV positive and the other one is not yet infected. I emphasize the concept of not yet infected because I know today, and I want many Ugandans to understand, that being discordant is not a permanent situation if you don't take steps to protect yourself. I thank today, I will always be thankful to my husband that he made that decision and said, you know, I am HIV positive. They are saying you are negative. So I am not going to ever infect you because I want you to remain and take care of our children. And so that helped me a lot. You know, when you have a spouse who is dying, the emotions are very heavy. I would look at my husband because I was given no room to even doubt that he would be dead soon, despite the fact that they gave him the best care. We were in a hospital called Castle Hill Hospital in Hull, and he was given the best care possible. But we were given to understand right from the beginning that there was no treatment for the virus, but that they are able to treat the opportunistic infections that are caused by the virus. And this is where the seed of that grew into Taso was made in this hospital. By the time I came back here, I understood pretty well that even if a person has AIDS and they may not be cured, their quality of life can be improved by treating the opportunistic infections, by being empathetic with them, by explaining to them some of the basic steps they can take to improve and prolong their lives. So it is because it was explained to me very, very clearly at Castle Hill Hospital when we began to set up the support group here in Uganda. That is the basis upon which we set up Taso.
How did you manage to pull through? Because you know, like, I just imagine all the emotions and everything that you went through. Now, having found out that you're discordant, how did you manage to beat the stigma? Because remember, that didn't exist at that time. And I remember the times when they used to talk about it, you were also being pointed fingers at, and everybody was just thinking, she's hiding under the carpet, but she is also, you know, infected.
I'll never forget, you know, there would be times when I would be going through the car park, the taxi park, because one of the elements of the very, very early elements of our struggle was we made a decision to be open, both Christoph and I. And I also am very thankful because Christopher's family was very supportive. Because what we found out is the people that we were reaching out and encouraging them to come and join us as a support group and fight. We fight together. We fight in the open. Some of them were very willing to be open, but their families were adamant. Don't bring that curse on our family. If you went and caught AIDS, don't tell other people that you are a member of our family and you have AIDS. So many people were being stopped to take up what they wanted to do by the families. So I am very grateful to Christopher Kaleba's family, my mother-in-law, my father-in-law. They were both still alive at that time. They have already gone to be with the Lord. My brothers-in-law, they were very, very supportive. And so when we shared with them what we wanted to do, they said, we will support you. We will support you if that's what you think you need to do. So the stigma was excruciating. At the time, we lived on Buganda Road flats. And the children were going to Buganda Road Primary School and Nakasero Primary School, the two children that were already going to school. So there came a time we were living on the third floor. After Christopher came back, before he died, there came a time that if I needed to take Christopher out for a walk, if the moment I started down the stairs to actually go, because we were on the third floor, to go down, if the neighbors would be around, suddenly everybody has disappeared. You look and everybody has disappeared. You can imagine, you know, these are neighbors you've lived with and they have been your friends, and it made me so angry. What else also made me angry, and you know, anger is a very powerful emotion. You thank God if He guides you, that you use that anger positively. I think I can witness that I used my anger against stigma positively by mobilizing others and saying to people that if we don't stand up for ourselves, nobody will stand up for us. I mean, today we have a saying, webereremu in Luganda. I don't know how that translates in English. Webereremu. We gave that example visibly. So the early people who joined us took a risk, but they took a risk on behalf of the many today who are enjoying care and treatment. And I'm not saying stigma has gone out, but it is much less. It is and they are gallant men and women who are living positively with HIV and can stand up. I mean, like the recent World AIDS Day experience we had, Dr. Watiti is a medical doctor. He stood out there. I felt so proud of that young man. He's not so young, but I really felt like a mother who was part of a process that has brought people through hell. Because, you know, AIDS is a devastating disease, but the stigma related to it is even more devastating, because it's not only limited to the person who is HIV positive, it transcends to the family. I remember my children, during one of the recent publications I have made, they share their experiences of stigma as children of Christopher and Noreen Kaleba. At that time, I did not bother to tell Ugandans that I had taken the HIV test and it was negative, because I knew they would never believe me. They would never believe me. And I also will confess, even I myself did not understand, because the doctor didn't understand. So who am I to understand when the doctor can't understand? So he said, you know, you'll have to do the test again after 6 weeks. We repeat the test and you see what happens. I made a decision very early that even after that 6 weeks, I'm not going to take another test. If I have HIV, I will never transmit it to anybody. If I don't have HIV, I will never catch it from anybody. And I realized quite early that if for both situations, what you have to do is the same.
Now, in terms of your success, I believe at the time when Taso finally became so popular, it was it's still up to now one of the support groups for psychosocial support. That clearly stood out. What are some of the other things you can say, we did this differently, that's why we were able to ensure that the prevalence rate went low?
Yes. I think I should mention that during that time, we had one very clear advantage, and I will always mention that advantage, that we had a political leader, President Yoweri Museveni, who decided that he will be open about what Uganda was going through with regard to HIV and AIDS. At that time, many African leaders kind of shied away from articulating that. In fact, I remember we would go to meetings, and whenever we spoke about AIDS in Uganda, other Africans would approach it and they said, "You Ugandans, are you crazy? Why are you so open about this pandemic? It will stop, it will completely destroy your tourism industry. People will stop coming to your country." So I say that the environment that was created by the decision made by the government to be open about HIV was very, very, very supportive. The other one was at the time, we were also because my husband was diagnosed in England. When he was discharged from the UK, we asked for him to be discharged because he said, well, I know that I'm not going to live long, but I don't want to die before going back home. I don't want to die before doing something about raising awareness about this disease. And when he made that decision, the hospital, Castle Hill Hospital, where he had been admitted, packed us off with a lot of medicines for treating opportunistic infections. So the people who came to us, not only just for counseling, they realized that when you came to us with an opportunistic infection, for example, one of the worst infection that was preventing people from eating was having sores in the mouth. So we came with medicine that we would give people, and the person would come and after a week and come back and say, I'm feeling better, I'm able to eat better. We also had medicine that would arrest some of the excessive diarrhea. So when people came to us and we shared with them those medicines, and they came back and feeling much better. They said, well, yeah, what you are saying actually works. And that's where we coined the term of living positively and dying with dignity. The living positively was that people, even if they were dying, at least they shouldn't die with so much pain. They should be helped to die without pain. And also dying with dignity was to do with the stigma. Because we know as a country, as a nation, we are very compassionate. We are very empathetic people. If you are sick, your family tells the rest of the family, so and so is sick. We have taken them to Nsambia, we have taken them to Mulago. Then people start streaming in to come and visit you. But people were not visiting each other. As soon as they realized that person had AIDS, they just ran. So that's where dying with dignity came from. The other element was we began to see that small children were being left to nurse their parents. You arrive at a homestead, the rest of the adults are there and they say, oh, Taso, you have come. Your person is behind there in the other room out there. You would go there and then you find a child, a small child, is the one who takes the food the person who is sick. And the rest, we are just folding their hands, waiting for the person to die. So we said, dying with dignity. I mean, a person to die being nursed by your own 7-year-old, 8-year-old was a devastating indignity that was being bestowed upon people who are dying with AIDS. So we coined a theme, said, living positively and dying with dignity. I'm glad today we know that when you have HIV, it can be treated. So we have taken off the dying with dignity because we have realized we have come a long way. But at that time, if you knew you had HIV, you had AIDS, the next step, you were dying. So we began to also coined another theme that energized us a lot. Said, AIDS is a family disease. If the family rejects you, you are gone. If the family decides that they will be with you through the journey, even if you die a happy person. And that theme continues today in the work that Taso does. Today, we know that even if you have HIV, you are treatable. If you have HIV, you can get to a stage where if your virus is undetectable and you commit to taking your medicines consistently according to the guidance of the doctor, you get to a stage where you are no longer able to transmit HIV to another person. Never mind if you are a young lady, you are a young couple, you may not even be young, but you want to have a child. It is possible for a woman who tests HIV positive but adheres to the instructions of the healthcare worker can bear a child without HIV. At that time, the story was different. Very, 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 very sad. The early patients would come with their children. Then a month later, the woman comes without the child and they say, but where is the child? Say, well, the child died. And that's why personally, I feel very, very vindicated. The efforts that we put in the beginning. Today, I think Ugandans know that there is an organization called Baila Uganda. They initiated the pediatric caring that is targeted primarily on the children who have HIV or who are born by families that have HIV. And that has completely transformed the scene. So we also were very, very, very emphatic on saying that it takes two to transmit a virus. If we care for those who have the virus and they realize that they have the power to limit the spread of that infection, then we will stop HIV transmission. That's what we are seeing today.
Then when you talk about that, now when we go to World AIDS Day, there is the communication, or there is actually now it is public information that you remember around your time when you say when Christopher was diagnosed, you were in your 30s, but now it's the reverse. It is the younger generation between the age bracket of 15, maybe, and like 19 or so, and more especially the girl child. What's your take on what is going on?
What is going on is a mix of things. It's really sad, but it's a reality that is born from the fact that this is my personal perspective. You can read the official perspective from the Uganda AIDS Commission. It is a mix of things that are happening. The 15 to 25 age group, within that age group, there are also children who were born with HIV. Because don't forget that the reality of bearing children without HIV as a result of access to antiretroviral treatment is like 10 years in this country. So that's one. The other one, sadly, the issue of intergenerational sex continues. Older, particularly men, are targeting younger girls in the hope that they are still free, and therefore, and these are selfish individuals, and I'm not saying every man, but unfortunately, as a human race, we have good people and not so good people. These are specifically targeting these girls saying, I don't want to wear condoms, I don't want to be inconvenienced, so I'll go for the younger ones who are not yet infected. The other one is, I think, is a mix of, we have, I think, kind of candidly taken the foot off the pedal of information dissemination. Partly because there is this totally misinformed information circulating that there is treatment for HIV. So I shouldn't care so much about HIV. Now that is total misinformation. Yes, there is treatment that makes the virus, kind of affects the virus in such a way that you can live full life, but you have to be on that treatment for the rest of your life. It takes over your life. But also, people need to recognize that this treatment is today being made available by the kind donation of our international community. Totally. Because there is no way where we are today as a country that we could ever afford to buy those medications for everybody who needs them if the spread of HIV continues. That's why, again led by Taso, the Ugandan community decided that you cannot mop the floor dry if the tap keeps leaking. Because we started by focusing in Taso, we started by focusing on those who have HIV. We care for them, we motivate them, and they become the instrument of change, of sexual change. But while we do that, we don't want the tap to continue leaking. So that's why you hear today, every organization, Taso inclusive, makes effort to both contribute to prevention, primary prevention, disseminate correct information, encourage young men to be circumcised medically, encourage couples that are going to have children to be tested. And in fact, I should have started with testing, because until you know your status, you don't know what category you fall in. You don't know what action you need to take. Now, but that information is no longer equitably available, especially among young people, in a language they understand. We have remained in the old mode of communicating the way you and I learned about HIV. Now, the young person today is a TikToker, the medium of communication for young people is completely different. There is, again, in my perspective, there is another added evil, and that is the use of intoxicating substances. Our strategy of dealing with AIDS, A, B, C, abstinence, be faithful, consistent, correct use of condom, is still valid. But if you are under the influence of intoxication, you can't make a decision that enables you to use either of those three. And the growing trend towards intoxicating substances, alcohol, drugs, whatever substances young people are increasingly using, is also partly responsible for the rise in new infections. The other one, and because I am on speaking with the media people, the media was a critical tool we used consistently to inform Ugandans. Today, we only do it during December, sporadically, and also unless you have funding to get space on media, it is very rare that you are able to communicate to our people. So unless we unblock that media channel, find an innovative way of making regular airtime available in the local languages, using the churches, using the mosques, using the infrastructure that we already have on the community. I think there's been some element of relaxation. And also, I think it's also very important for parents to also take some part of the blame. We are running around making money, chasing money. We don't necessarily equitably provide time for the young people to seek help and explanation of things they don't understand. We send children to school and we expect the schools to take charge of everything. So, and just speaking now as a grandmother and saying that we have to go back to basics at so many levels. We have, first of all, to look at the messages that are going out. I chair the Uganda AIDS Commission committee, which clears messages that are disseminated to Ugandans. And I can see that that trend is beginning to catch up. People are now producing messages that are targeted towards the young people, that are able to speak their language. But although the problem is some of their language may not be acceptable culturally or religiously among the older population. So we are struggling a little bit because we want to use their language, but we don't want to offend the judges in the community. So my committee tries to balance that, because we have realized that if we use the same language that the judges understand, the young people don't understand that. They don't want to know that language. So we are really looking towards partners in this country that are eloquent in producing messages to sort of, balance up. Not use language that is not accepted, especially in our culture, but use language that young people can understand.
Mm-hmm. Now, it's quite amazing when you talk about some of these things, and I'm looking and I'm like, okay, I think there's some areas where you can clearly see that's where the problem is. Now, at the time when you were going through the phase after Christopher had passed on, how were you able to balance single motherhood with a big responsibility of ensuring that the support organization you set out to put out is able to bear and hold the flag high up to today?
Going back to my own personal experience, and I say this I try to share this in my memoir. I thank God that I was endowed right from my birth with some very selective pillars of resilience, of survival. And these, I sometimes summarize them as my 3 F's, letter F. Mm-hmm. The first one is faith in God. The second one is family. The third one is friends. And all of these 3, they have many branches. And one of the key branches, and I always say, I was blessed in the sense that tragedy befell me after I already had a concrete and very firm foundation of a good education. I went to Mount St. Mary's in Amagonga, the best school in the world. So by the time things were happening and I was receiving this diagnosis, I was already, like I said, I was already the principal of the School of Physiotherapy. So what they were talking about, I was able to understand almost instantly. So I didn't have the dilemma of checking the language and saying what he's saying and then running off to the... And because I had a good education, I also had a faith in God. I worship with the Catholic Church. And I was able to distinguish between Bakuroga and a scientific disease that is going on in my husband's body. The other one, and faith also, I had faith in my husband. Because I get asked quite often, how come that you didn't get angry with him? When we found that you were negative, he was positive. To tell you the truth, I had no time for anger. The only time the anger I had was against stigma. I had no time. You know, when you see the man you love, the father of your children, and the doctor tells you, well, you don't have much time. It is the most urgent is to see what can I do to make his life better while he's here with me. So I did not have any space to blame him or ask him, where did you get it from? And this is what I say to people who I meet. You waste your time asking where the virus came from. It's like finding a snake. It comes into your house, it's molesting your family, it is molesting a family. Instead of getting the stick, hit the snake, make it, after it is dead, you've thrown it out. Then you say, hey, by the way, where did this stick come from? That's what I did. After my husband died, I began to ask myself, where did this virus come from? But I did not, it wasn't, where did he get it from? To bring it to my family. That's another very, very important emotion to overcome once you get a diagnosis of HIV in the family. But I was able to quickly find out that, my husband had, and you probably don't know, but you will know from today, he had an accident in 1983 on Bombo Road there. He was crossing the road, he was run over by a bus. Those buses used to be called Kukurunat. I think they are off the road because I prayed to God to take them off the road. So, and he had a fracture. He was taken to Mulago Hospital, and during the whole month while he was given 8 units of blood. At that time, 1983, there was no routine testing of blood for HIV because we didn't even know we had HIV. We knew. The ministry knew, but we were still struggling. What is it? Where is it? If you ask Dr. Wegaba, I really encourage you to find Dr. Wegaba because he's the first man who identified the first case of AIDS. He's there, and I think His Excellency honored him this last World AIDS Day at Rakai. So by the time I was able to know that, he was gone. There was nothing I could do, but it gave me the energy to be able to speak to couples when they find that one is HIV infected, the other one isn't, to sort of try and help them to reconcile around caring for each other. And I'm glad because I interact a lot with the discordant couples. And I speak with them and I encourage them and I say, it is possible for you to live together even as a couple.
Then, doctor, that brings me to the question of, like, now that you've talked about that, how? Because I imagine there are certain times there is still that perception of where people believe since you're discordant, you need to run away. You were widowed at a young age. How did you move on with your life? This is now a little bit, did you still choose to close in and say, now that this happened, this is where my focus is and the energy? Because you said your catchphrase was like, you have to make sure you stay safe. Yes. How would you encourage discordant couples now? Because there are certain times people think, and the families are the ones, like you said, among your Fs, many families do not accept and do not want to hear of the fact that a couple is discordant and they are moving on together.
Yeah, it's not a decision that you can prescribe for anybody, but you can take them through a counseling process and they make a decision for themselves. Because I have always said, HIV does not split families. And if you see a family which has been split by the diagnosis, only by the diagnosis of HIV, or by the or having only girls or having only boys, they already had other problems. And this one is just the immediate one they are using to split. I personally, I was only 32 years old when I was widowed. It took me a long time to trust. When you lose a spouse, Uh, it's like sometimes you get to a stage, especially with HIV, there is also, people don't realize the survival guilt. You feel guilty sometimes that you have survived something that has taken your loved one with so much pain. Sometimes, as they go through the pain, you wish you could share the pain and make it less for them. And once they die, that feeling of guilt does not just melt away. And every time the children are going through a step in life and the other one is not there, you say, I wish he was here. I wish she was there. If she was there, that wouldn't happen. If that wouldn't happen. But it doesn't mean that your body stops functioning. You still function as a woman or as a man. But for me, like I already have shared, I had already taken a decision that if I find somebody I'm attracted to, and who proclaim that they are attracted to me, the first conversation between us is to remind them, if they don't already know, that my husband died of AIDS. And then usually, at least in my experience, usually once you do that, they don't come back. Then you know that human being was not part of you, it was not meant to be part of your life. But from time to time, I did come across one or two human beings who said, well, yeah, I understand. I don't know very much about AIDS, but I am happy to learn from you. And then you say, okay, that conversation is taken on to another level. You get a counselor. And fortunately, the woman who was my matron, and for who I was a matron when she was getting her husband, is still alive. And she's my best friend. And she's a counselor. So all this I'm talking about, she knows. Because she's been there, part of my journey. Getting into a relationship is a journey. In my life, it has been a journey. It has very specific steps. Conversation, information, counseling, then making a decision. Because by the time, as I said, by the time Christopher died, we had already made a decision that we're not going to have any more children. And as you know, in our culture, it is the woman who has the responsibility to implement that decision. So I had already had my terminal fertility journey closed. I had before my husband died. So that conversation also has to come out and say, yes, I can see you are very intrigued by me, but do you know that when you were in my life, me, I can't have children. I don't know if you want children. And that step too. And if they want children, off they go. So the line gets shorter and shorter until you get to a stage, you get to someone who is genuinely interested in you. And of course, the other element which I will never leave out, prayer. We speak lightly about take it to the Lord in prayer. This is something I prescribe to many people who find themselves in a similar situation. Like, take it to the Lord in prayer. After you've had that conversation, just take it to Mother Mary. And although she didn't have a personal experience like that, but she's wise. She's a wise woman. When the angel talked language she didn't understand, she said, he just said, your will be done. She didn't understand, but she had faith. So that has been the story of my life. Right now, I don't have a person in my life. I would like a person in my life. So if there is anyone who wants to go through the steps, it doesn't happen overnight. It is a step by step.
Now, Doctor, I'd like to ask you another one. We strongly say, for you, it's something that has been there. Let the communities lead. You have used the communities to be able to make the foundation of Taso. Right now, much as you retired of Taso and you're the patron, it is still going strong. As you retired of UNAIDS, I do not know whether that was some of the key words that you were using there or some of the messages that you'd still pass across. Ending AIDS by 2030, Is it doable? Is it achievable?
It is achievable, but it is only a goal. A goal is an aspiration. It's a global aspiration. If I look at where we are today, yes, it is achievable, and we must all collectively commit to that aspiration. But as our commitment, there are things we need to twist and twitch in order for us to make that goal. And I'll begin from the broader. Let me begin at home here in Uganda. One of the elements that is lagging behind is the policy frameworks within which we are working to control AIDS. If you are aware, or if you are not, I would encourage you to read the HIV Prevention Act that was approved by Parliament and assented by the President. That act is beautiful, but it has elements in it, elements related to human rights that threaten that act and to stop it from achieving what we are supposed to achieve. And these elements are about intentional transmission. It's about mostly informing, that a healthcare worker can inform the person of my status without my consent. Now, those elements threaten and stop people going to know their status, because implicitly, if I find a man who I have appealed for here today, and we go through the steps, now if I am the first, I already know my status. That guy can turn around and say, Noreen gave me HIV infection. Now, I don't know whether, much as he didn't disclose to me, he may have already been infected. But because I am the person who is known to have HIV infection, and there is no technical way anyone today can check that the infection that he says I gave him is my infection. You see that? So, many people who won't be bothered. I will not take my test, because if I take my test, if I am in a situation like that in a court, I am the guilty one. So whatever I don't know will not hurt me. You see that potential? Equally, the anti-homosexual bill, and all these things, today in this meeting, we've been revising these things, because we as civil society, whenever these bills were being drafted, we always sat with the legislators, we guided them, we said, look, this element and this element and this element in this bill is already present in the penal code. We don't need to stand it out and put it, because it will put the minorities in this country who are very vulnerable into a situation where they feel persecuted. Now, so the legislative framework needs to be twisted again. And for us, we will not stop asking gently. We are not forcing, because Ugandans, we are an indigenous country. We are independent. So once the legislators vote, and these are the people we put in parliament, so we as civil society, we can't sort of stand up and protest against them, because they represent the people. But we need to twist and twitch those elements and take them out in order to allow the minorities who today are feeling very marginalized. And they are feeling, we keep saying about saying we leave no one behind. But if the legislative framework leaves some people behind, then we are leaving people behind. So that we need to do that. The other one, we need to get the media back into the driving seat. We need you guys to have a regular program allotted to providing information on HIV and AIDS. Parents need to regain their responsibilities as parents. Our parent, my mother, did not go to school, but she taught me the basics I needed to be able to stand today where I stand. So those twists and teaching. The other one, which is very important, we need to harness our local resources a bit more to become less and less dependent on, on the mercy of the international community. We are very grateful. They have given us a lot of support, but there are some elements of what we need to do which only us as Ugandans understand. So we need to harness, and I can even give a very, very eloquent appeal. Ugandans, Taso is a membership organization. You become a member of Taso not by virtue of the fact that you are HIV positive, but by virtue of the fact that you care. You care to defeat AIDS. As a member, you can become a member from a range of 10,000 a year, 10,000 a year, to 50 million a year. And with that money, we are able to do innovative things, some of which are not understood by our international partners, which we think are important for us. Like, for example, in amplifying the voice of those who are HIV positive and are willing to use their experience to accompany the rest of the community to bring the reality of HIV home. Because we have men, women, and children who are able and ready, but they need to be trained, they need to be supported, to be available as members of the village health committee, open, and they are willing, but we don't have the resources that are targeted towards that. Music, dance, and drama is a key medium. That is one of the least funded items among the things for which we receive funding internationally. And yet it's the most informative to our people.
Yeah, very true. I do really, really appreciate it. It's been very wonderful for you to come out and spare time of your busy schedule and be able to share this useful information, especially to the young people who did not know about you, who did not possibly know about Taso, who possibly think it is a government entity. We do really appreciate for your precious time. Thank you so much. And the public who've been watching, I am telling you, we can take the whole day. We can sit and extract a lot of information from her because you can see how passionate she is about the topic. But please do listen out carefully to some of the things she's talked about. You can visit the TAFSO website for more information. For me, it has been a whole wealth of experience sitting with the founder member of TASO, and she's retired. She's just acting as a patron right now, and also one of the people who is been very supportive, much as she retired of it, that is UNAIDS, and they have supported a lot in a lot of the policies and are still ongoing. So much as she's not in the country most of the times, I believe we shall always look out for her as UHealth Chat, and we find time to extract some very useful and pertinent information from her. That's all we had for you tonight. Thank you for watching. Keep watching UBC TV for the 10 o'clock news is coming your way shortly. Good night.